We have Councillor Boschman, Vice President Van Hazinga, and Councillor Cruz, as well as myself, President Zarella. And I now call this meeting to order. Please be advised that FATV will be conducting audio and video recording for public broadcast. I ask that anyone in the audience who is recording, please stand and identify yourselves by stating your name and address. Seeing none, the public had been advised to contact the city clerk's office with any public comments, and none were sent to us. There is also no one in the audience who appears to need to speak at public comment. However, we do have two city officials with us this evening, and thank you for coming, who will speak on the appropriate agenda items. We have three orders and one discussion item on our agenda this evening. To begin, we have 01222, an order that the City of Fitchburg hereby approves the expenditure of funds from a contribution from BOT Realty LLC in the approximate amount of $21,500 for the purpose of said grant, which is for the paving and reconstruction of Perkins Street. Mr. Erickson?
Good evening, councillors. Auditor Brooks. So this petition is to accept a donation from BOT Realty in the amount of $21,500, as is stated. The purpose is to donate to the paving and reconstruction of Perkins Street. This was part of a planning board letter of, I'm trying to blank on the terminology, but an order of conditions, essentially. I'm sure you know, Councillor Van Hazinga.
Yeah, I would say a condition of approval.
Condition of approval. So this Perkins Street was actually reconstructed by DPW using a contract with PJ Albert this summer. So the road came out very well. The property owner of BOT Realty has been very cooperative throughout the entire process as far as making sure that his landscape islands that are within the city right-of-way conform to what the planning board required. And he did use granite curb along the length of Perkins Street per our city specs. The pavement came out great. It's a big improvement over what was there. It had essentially deteriorated to what amounted to a dirt road. So it's nice to have that road nice and smooth, easily traveled for Aldrich, which is to the right, and then the BOT Realty businesses to the left. I believe he's opening a cannabis dispensary there. So I would recommend that the committee move to approve the acceptance of this $21,500, and that value will be credited to the city's road reconstruction account to reimburse us for paving that roadway this past summer.
All right, and just for point of reference, approximately what percentage of the total cost of the repaving does this cover?
A little bit more than 50%. I think the total came out to roughly $38,000,
okay,
if I'm not mistaken. So it covered a little bit more than half. And like I said, we did require them to put in that vertical granite curb on the business side of the roadway along that edge. And that goes towards reimbursing us for having to do that also.
That sounds good to me. Councillors? Councillor Boschman?
The question to you is this, Perkins Street, you're saying it costs approximately $38,000. So would it be fair to say that any street that size in Fitchburg is just $38,000 or less?
I don't think that's a fair statement. It depends on the width of the roadway and the depth of asphalt that you put down, whether we mill and overlay, whether we do full depth reclamation. There's a lot of other factors that go into it. The number of drainage structures along that stretch of roadway, whether we're putting back berm, curbing, sidewalk. So I guess the answer is no.
Did we do it full depth over there on Perkins Street, or did we just do it?
We did do full depth with calcium chloride, 3.5 inches of pavement. I don't recall the widths off the top of my head. I think the roadway widths were about 22 feet, which is actually pretty narrow for a public roadway. But the benefit of paving that roadway, or the easy part of paving that roadway, is that there weren't any structures with the exception of one catch basin and I believe 1 or 2 sewer manholes out there. So it wasn't very costly aside from the asphalt itself.
Okay.
Thank you.
Make a motion, we accept.
Second?
If the counselor is willing, before we take that up, I'd like to entertain a minor clerical amendment just to change the word grant to contribution in the order.
Okay, I'm willing.
Would someone make the motion?
Make a motion. Oh,
Second?
All right, I have a motion and second to amend. It's probably irrelevant, but just for technical accuracy. If there is no objection, we'll take this by unanimous consent. Seeing no objection, amendment passes.
Make a
And
motion, we accept.
Second?
I have a motion and second to approve the order. If there is no objection, all right, motion passes.
Thank you, councilors.
Thank you very much. Next up, we have 01322, an order that the City of Fitchburg hereby approves the expenditure of funds from the Massachusetts Executive Office of Public Safety and Security, VAWA grant in the approximate amount of $69,027, though that number will need to be amended, as Chief Martineau will explain, for the purpose of said grant, which is to support the domestic violence advocate position within the police department. Chief?
Okay, let me start off by requesting that amendment in that dollar figure. That dollar figure was sent over incorrectly from my office. The actual number is $62,097 versus the amount that's stated on this form at $69,027. So the number needs to change to that. Just to give you a little bit of update, most of the councilors are aware of our domestic violence advocates position. It's a position we've had here in the city for probably going on 11 years now. It's a position that has been funded fully by the federal government for the last 10 years. Just to give you an understanding what our domestic violent advocate may do in a given year, as outlined in my annual report, the advocate completes approximately 87 home visits during a year's time. Last year, she tried and attempted 196 visits, but 87 of those visits we actually offered services to. In any given year, the Fitchburg Police Department may respond to somewhere in excess of 300 to 400 calls for service that are domestic related. And like I said, for the last, this going on year 11, we've been very fortunate to apply for a federal grant to cover the full cost of our advocate's position. Out of the $62,097, about $59,000 of it, $59,421 to be precise, is for salary and for fringe benefits. Then there's some ancillary items that come out of that for cell phones, computers, office supplies, and training, and also grant reporting. One thing you may notice in my annual budget in the next couple months is you're going to see a line item in the annual budget that only reflects about $27,000 going back to the DV position. That's because we're on an off cycle from the federal government. So when we get notice of award in January, we're always 6 months behind. So as you see in my budget this year, you're going to see about a $27,000 reduction for the DV advocate. That's typical, but I like to explain it usually this time of year during finance. And historically, like I said, for the last 11 years, we've been able to get the full amount supplied back to the city for this position. I think is extremely important, providing advocacy services to those that needed it the most during a domestic incident. So I'll be happy to answer any questions as it relates to the domestic violence advocate's position or anything to do with the funds.
Councillor Brochman?
As educators we're getting, everybody's getting degrees in that. Is this improving or is it staying about the same? The violence, domestic violence in the city.
Domestic violence, if you refer back to my annual report, last year we reported 327 instances of domestic violence. Over the last 5 years, it stayed pretty consistent, with 2018 being the lowest year, with 298 incidences of domestic violence, reported domestic violence. And keep in mind, what this advocate does is she reviews every domestic violence call that comes into the city, and then she reaches out and does advocacy work in conjunction with the district court and their advocates. So it's a second level of advocacy that we're providing that's extremely unique. Not a lot of departments provide that second level of advocacy, but, you know, for someone that's been in a domestic situation, there's nothing better than having that type of support system. And like I said, the most important thing this grant is, this is fully funded. There's no cost to the city. This is a position that I think is extremely important, and every year, once again, we're able to obtain federal funds for it.
Yeah, I want to make it clear, I'm not against your fund here. I just want to know if we're improving as human beings. I was going to ask you, is it a lot of the problems drugs and alcohol when we have these calls for domestic violence?
There's a whole host of reasons why domestic violence happens, and you know, we're no different than any other community that has seen increases and decreases in domestic violence. You know, some would say that during the pandemic they may have increased. We may have saw that a little bit. If you look at these numbers, prior to the pandemic, we were at 291. Now we're at 327. Is that because more people are at home? You know, there's many different factors that are involved here. I think what's important to really note when talking about stuff like this is the extra work we're doing here in Fitchburg to provide victims of crimes, victims of domestic violence, that extra level of service. So I think that's what's really important to highlight, you know, on evenings like this.
All right. I make a motion we accept it, unless somebody's got questions.
Make a motion to amend the amount to $62,097.
Oh, sorry about that.
Second.
I
I
second
have a
it.
motion and second to make the appropriate amendment of the dollar amount. If there's no objection,
Make a motion we accept this. Oh,
not done yet.
well, you were looking at me.
If there's no objection, then the amendment passes. Now it is before us as amended.
I make a motion.
Go ahead.
We accept the amendment. Done.
I second.
I have a motion and second to approve as amended. And on the motion, I would just like to note that I'm very pleased that this is something that we continue to do and funding that we continue to fight for. Your office always does such a great job of getting all these kinds of grants, but this one in particular, I've spoken to people at all levels of socioeconomic status who either have dealt with or know someone who has dealt with domestic violence. It's not, you know, it cuts across lines of class and race and everything else. And one of the things I hear the most is that one thing that makes a difference is knowing that someone's actually paying attention. That when they reach out for help, it's not just that someone's gonna, you know, show up to the call, go away later that night, and then they're on their own again. So this is a program I'm very happy to have in the city, and I think that it's whether we are or are not able to quantify the exact effect, I've got to believe it's making people's lives better in this city. That being said, if there is no objection, we'll take this under unanimous consent. Seeing no objection, motion passes. Next up, we have 01422, an order that the City of Fitchburg hereby approves the expenditure of funds from the Department of Justice, Bureau of Justice Affairs, Comprehensive Opioid Stimulant and Substance Abuse Program grant in the approximate amount of $504,061.86 for the purpose of said grant, which is to contract a licensed clinical social worker to provide follow-up and case management to persons who are suffering from substance abuse and co-occurring disorders, as well as training and data tracking. Chief?
Thank you. Well, this is something that I've been waiting 3 years to get in front of this body and the council. This is something that we started exploring here in the city of Fitchburg 3 years ago. We've applied for grants the last couple of years unsuccessfully. And this year, we were finally successful in bringing this opportunity to the city of Fitchburg and to the people that truly need it the most. This comprehensive opiate stimulus substance abuse program was developed as part of a comprehensive Addiction and Recovery Act legislation. It's a wide scope of programs awarded, which include programs that are focused on court-based intervention, take-back programs, Narcan programs, and in a multidisciplinary law enforcement approach. Let me explain that in more layman's terms. This is a co-responder model where clinicians, licensed clinicians, master-level clinicians, are working hand-in-hand with law enforcement in a manner to go out and provide services to those that are suffering from substance use disorder or mental health issues. This grant was extremely competitive this past year. Some things that I'd like to point out: only 99 awards were granted nationally. Only 3 awards were granted in the state of Massachusetts. And I think Councilor Boschman will appreciate this. There is a no match on this grant. This is not costing the taxpayers of the city of Fitchburg $0. So
Oh, I like that.
this is $500,000 coming to the city in services at zero cost to the taxpayer. That's going to be called the Fitchburg Outreach Initiative Program. As we're well aware, we continue to battle with substance use disorder and try to find solutions for those that are suffering from substance use disorders. To give you a little bit of history of what we saw this past year as we're starting to put together our data for my annual report. In 2021, the Fitchburg Police Department, our offices responded to 177 calls where someone was in an overdose situation, where they had overdosed and they were suffering from the effects of the overdose. During that time, my officers deployed Narcan 90 times, saving individuals from death because of the overdose issue. So we continue to battle the issues that go around substance use disorder. While we've seen the numbers decline slightly, but we're also seeing the numbers of Narcan deployment go up because there's better education when it comes to Narcan. This program here will bring a master's level clinician to work hand in hand with my police officers. We already have a client list set. So this program, this clinician, this full-time clinician, that person already has a client list of 177 clients that overdosed in the city of Fitchburg last year. This clinician will reach out the next day, the day after, the day after, and the day after, finding resources, finding treatments, finding beds, finding solutions, lending support, lending compassion, and trying to get that person to the next level beyond their addiction. This is shown, this program has made leaps and bounds throughout the country in this type of model where police officers are co-responding with clinical support. Clinical support going out with non-uniformed police officers in plain clothes and trying to find solutions for those that really need it the most. To give you a little bit of breakdown, because it's $500,000, I'd like to give you just a little bit of breakdown of what that money is going to look like year 1, 2, and 3. This is a 3-year grant funded by the federal government, and each year is broken down into specific costs. The first year, the total cost that we're going to be spending out of this money is $150,000 and change. Out of that $150,000, $97,500 will go towards to pay for 1.5 clinicians. And the reason we do 1.5 clinicians is because we always want coverage. Oh, let me back up. More importantly, in order to get this grant, we had to partner with a healthcare provider. We've had a relationship with Community Health Connection, Community Health, UMass Memorial. We've had a relationship with them on our crisis intervention, and they were the likely partner to go into this with us. They are providing the clinician for us. This is not going to be a person on our payroll. They are a subcontractor, and this grant will pay for their clinician. So like I said, that first year, roughly $119,000 will go towards that personnel, that clinician, and that will cover their fringe benefits, taxes, payroll for community health. And then on top of that, we have some additional costs as it's related to computers, phones, budgetary tracking, stuff of that nature. So the first year is roughly $150,000, and then it goes up each year to a point where it's, the total budget with Community Health Link is $450,000. The other $50,000, that stays within the department, that goes towards our budget, towards reporting to federal reporting for fiduciary reports. My two clerks will spend a considerable amount of time logging all this, so we put in X amount of dollars to help offset some of the costs that are locally. In addition, this grant requires us to attend yearly conferences as it's related to this co-responder model. So whoever this clinician will be, we will be traveling to get the latest technology, what's happening in the world of this co-responder model. Like I said, I've been waiting 3 years to get this in front of this council. This is cutting-edge police, clinical support working together, trying to find solutions for those who need it the most. And, I can't wait to see what type of impact that has on the numbers and those people that are really suffering from this disease of addiction, and what type of services that we can provide. I think it's going to be a phenomenal system, and I can't wait to see the outcomes of it. I could probably talk a little bit longer on this, but if you have any questions as it relates to this grant, I'd be happy to answer them.
I remember being excited about this when you first broached the issue, and thank you for continuing to plug away at it. I'm very much as excited. I don't think I can be as excited as you are about it, maybe, but I look forward to this very much.
I think every person knows someone that has suffered from addiction and suffered from just, that pain of dealing with this, whether it's a family member or a friend. This is going to provide that opportunity. Like I said, I have a client list. It's not like I'm trying to open a practice. I have a client list, and I can't wait to provide this additional services to that client list.
That's terrific. Councillor Brochman?
First of all, can the council get a copy of that, what you read off to us, or yeah or no?
I'd have to go through, that's up to the council president. I mean, absolutely, I can share this cost sheet if you'd like, Councillor, if
Sure. I mean, if it's convenient for you to do so.
I mean, it's all public record, so.
Yeah.
I'd like to have a copy. Okay, and my second thing is, and I'm all happy about the grant too, because I want to see people help, and I'm tired of reading in the paper people passing away from OD. But I wanted to ask you a question. The Board of Health came in front of the city of Fitchburg, in front of the council, a couple of weeks ago, or approximately a couple of weeks ago, remember? What's her name, Sue Christensen, and the guy they brought in on board to help the homeless and the people that are on drugs. Can we work hand in hand with the Board of Health too, you guys, on this particular issue? Because they're doing almost the exact same job that you want to do, you're doing. And I can't see having one hen over here doing their own things, and then we got another person over here doing another thing. If we combine the both, we can have a more powerful force in the city of Fitchburg.
I agree with you, and that's what's happening day in and day out. No one's working in silos here. My team talks often with Sue Christian in the health department. She is the substance use coordinator for the city of Fitchburg. She can apply for grants. I apply for grants. We do meet at the table. We do share data. This is just another step. This is just another tool in the toolbox. This is something that I wanted to bring to the police department because, quite frankly, like I said, we've already created a client list. I have 177 names, that will receive direct services. I've spoken at great length with Sue and how this relates as a team. We're not going to solve this by the police department ourselves. It's working with Sue in the work that she does in conjunction. So, we're already collaborating, Councilor. I guess that's the bottom line. There is communication. No one is working in their individual silos. We're all trying to accomplish the same thing, and that's to assist those that need it the most and somehow eradicate substance use disorder.
Now, I got a final question for you, and then I'll relax here. My question to you is this. You had 177 calls for OD, for Narcan. Now, have you ever filed a Chapter 35 or 53, whatever that is? I keep on bringing that up because I don't understand how we can sit here as a city, as a people,
Yep.
and you come and save my life 3 times in a week. Well, there's something wrong. I'm not thinking rational. If you're saving my life 3 times in a week, I'm not thinking positive. I'm sick.
Yep.
Because who wants to pass out and not knowing you're not going to wake up tomorrow morning? And I wonder why we're not pushing that more high with the courts and that. Because council president's not thinking right. So why would he, I'm just using that for example. You know what I mean? They may be a heck of a piss
Councilor
poor
Boschman's
but
planning a coup.
You know what I mean?
I do. And what you're asking is a great question, and unfortunately, you're not informed with the correct information. Section 35s, Section 12s are happening daily. The Fitchburg Police Department writes more Section 12s in a week's time than we ever have. So we're constantly looking at the person, looking at the client, looking at the person that is in a crisis, whether it's a crisis from an addiction to drugs, an addiction to alcohol, or has a mental health issue. So there's differences between the 35s and the 12s. The 12s is when someone has a tendency where they're thinking about harming themselves. We do Section 12s on a regular basis. So that, I don't have the statistical data tonight, but I can tell you, we do multiple Section 12s in a week's time. Section 35 is a little different. That's a court order that says someone has either an alcohol or a drug dependence issue. And it's ordered. That Section 35 is an order out of the court where they are committed to treatment. That is done all the time, too. And that's done not just by the police department, but it's done by family members. A family member can petition the court for a 35 and get forced treatment for those. Out of these 177, there is times that a 35 is appropriate, but there's also times that it's not appropriate. 35 would be a forced commitment. A lot of times, we look for other alternatives than forced commitment. We look for other alternatives in the criminal justice system, getting them involved in the court system. So what you asked is being done already. I can give you, I don't have the exact number of 35s and 12s we do in a year's time, but they're utilized, and they're utilized to the fullest. It's 2 different entities, but we utilize them on a consistent manner.
Right. And my final question, because it really bothers me the most, because I use a comparison. I know I'm going a little bit off track, Mr. President, but please let me finish it out, just to give an example. My argument, I have a problem with these 175 poor souls that are stuck on the hard stuff or whatever they are stuck on, and or anybody else that's out there walking the streets, whether it be Fitchburg, Leominster, anywhere. Do we actually go after these peddlers and nail them with an actual, besides distributing drugs, nail them with a crime bigger than just selling drugs, narcotics? What I'm saying, we say Boschman takes and he ends up in a hospital, he ends up in the funny farm for the rest of his life. But the guy over here to my left sold me the product, and you caught him. But I'm sick now. I'm sick the rest of my life. Are we just going after the guy saying he sold the product, he's a dealer, and that's it? But it's not going down the river saying, like you do with the guy that sells me a last beer at 2 o'clock in the morning, and you nail me on the cross for a bartender, but yet this guy that's peddling the drugs and doing more harm than good is just going to spend a little time in jail, and that's it. He doesn't have no repercussions or nothing. Mike, I don't know if I'm explaining it right. You understand what
Counselor,
I'm trying to say?
I think, let me take a stab at this because it's something I have studied a little bit, and Chief, obviously, step in if I'm stating anything incorrectly from your perspective, but I think you're asking whether we can go after drug dealers for the harm caused by the drugs.
Yeah.
In other words, if we can go after the drug dealers for homicide, essentially, or assault or whatever. And I don't actually, off the top of my head, know what the state of the law in Massachusetts specifically is on that. Maybe you can enlighten us on that, Chief, but I do know it's a tricky subject nationwide.
I'll be happy to address it. I know it has nothing to do with the order in front of you this evening.
Certainly, certainly. I just figured we can clear it out of the way.
These are two separate instances. I don't mind responding to the council, but it's a little bit different than what the order was this evening. The long story and the short story is the district attorney decides who they're going to prosecute. You can see from my data each and every year, no one takes a greater approach towards getting as much of these drugs off our city streets in my department. I have a full-time narcotic unit that does multiple search warrants each year. We're arresting drug dealers. We're getting that stuff to the best of our ability off the streets. We're funded through CDBG. A lot of effort goes into drug interdiction and really trying to eradicate it the best we can. As far as prosecution, that's up to the district attorney's office. Very few cases have been prosecuted where it's been identified that a illicit drug actually killed someone, and that drug dealer may have been charged with some type of wrongful death. Other than a death case, I can't recall of anything else. I can tell you that, seeing what comes out of the district attorney on our prosecution of these cases, the drug dealers are being held accountable, and when they're convicted, there's a considerable amount of time that goes with that sentence. Not only are we dealing with the state courts, the Fitchburg Police Department has a connection with the feds, too. I have police officers assigned to federal task force where the sentencing guidelines are even that much greater. So we're attacking the illicit sale of drugs here in the city on many different fronts, whether it's through the federal system and task force officers or local narcotic teams. But the bottom line, when it comes to identification and prosecution, that's up to the individual district attorneys. And every DA is different, but I can tell you that it has happened. But I also can tell you that sentencing, when convicted, there's substantial sentencing that's happening here.
All right, thank you. Thank you, Mr. President. Thank you, Chief.
Thank you, Chief, and I'm sorry for the small diversion. I just figured once I had heard where Councillor Boschman was going with that, it sounded like the kind of thing that a lot of members of the public were probably curious about. So
No, I'm glad I could explain to the councillor, and it's a good conversation because it highlights what we're trying to accomplish and what we're doing every day here in our city.
exactly, yeah, and I appreciate that approach. Help for the people who need help, and throw the book at the people who need a book
Addiction
thrown
has to
at
be
them.
tackled from both ends of the spectrum. Strict enforcement, going after the drug dealers, and compassion for those that are suffering from it. And somehow we'll meet in the middle and do our best to reconcile.
Exactly, I appreciate that. I had Councillor Cruz next.
Yeah, thank you, Mr. President. I just want to share President Zarrella's sentiments. I'm very excited about this. I think it's terrific, and I want to commend you and your department. We've talked about it before. Despite the national outcry for reform, the Fitchburg Police Department has been reimagining policing, as you put it, long before that, and this is a part of that. It really is. It's a wonderful grant that we're going to be able to take up to help people in need. And to answer your question, Councillor Boschman, I think what Mr. Barnaby and Ms. French, they're homeless outreach workers, so that's kind of where their speciality is, so to speak. And this is an all-encompassing addiction outreach type thing with people who are in homes, this 177 people. It's not just homeless. But I just have one question. So when we spoke about it before a little bit, this person, the social worker, it's going to be not just addiction, but any sort of mental health crisis, right? It's going to be multiple things.
Yeah, the primary focus is going to be on substance use disorder and addiction to illegal drugs. That's the primary focus, because we showed that we had a database that can support this type of activity. Mm-hmm. But as you're well aware, and the rest of you are well aware, everything has a connection. It could be an addiction issue, compounded to a homelessness issue, compounded to a mental health issue. So we have teams in place already at the police department known as crisis intervention teams that's dealing with the mental health aspect of it. We have teams set up now through the health department with homeless outreach, Keith Barnaby and Kim French. They're dealing with the homeless aspect of it, exactly where it belongs. The police department, we have our hands in a little bit of all of it because, quite frankly, we're out there 24 hours a day, 7 days a week, and we're running into all these different situations. So this clinician will primarily focus on substance use disorder, but it's also going to touch base on homelessness issues, chronic mental health issues. And that was one of the reasons we chose Community Health Link, was because we already had that relationship. We already have clinical support in the PD 2 days a week doing outreach services for those in some type of mental health crisis. So now this is just going to be an additional employee from CHL in the PD. So the primary focus is on substance use disorder, but one can't not connect all the other items that will go along with it. So it's going to encompass quite a bit.
Great. And I guess that was my only question. I yield the floor. Thank you, Mr. President.
Thank you. Vice President Van Hazinga?
Thank you. I just wanted to echo the sentiments previously mentioned that I want to commend you and your department for the hard work you've done over several years to secure this grant. I think this will have a real meaningful effect on the city and the department and its ability to not just respond to the symptoms of this problem, but to better work towards solving the causes. And thank you very much.
Thank you. And I'd just like to give one final plug. The police department, and I've given praise in the past, but I also continually praise Christy Fisher, who is our primary grant writer. Right now, we're managing over $1.2 million in federal in grants. That's a substantial amount of money that is not taxpayer-based that's coming in to the city each and every year. So just a kudos to Ms. Fisher and all that she does for our city and department.
Make a motion to approve 1422.
On the motion.
Do we have a second?
I'll second it.
Okay, on the motion?
One thing, Chief.
Yeah.
Do me a favor. Make Fitchburg proud so we can make Channel 5 News at 7 o'clock nationwide. All right? Make us proud.
Sure.
So we can make the
I
news
think
channel.
that's inevitable, Counselor.
Real quick, one
on
final
the
question. I remembered I was thinking, is there, and if we have to retract the motion, to ask the chief a question?
Yeah, Counselor.
It's fine.
Okay, motion is withdrawn.
So
Councilor Cruz?
you've been working on this for a few years now. Is there data of other similar cities and demographics that show how successful this grant has been for them?
I don't have an answer for you on that. This came to my attention out of the Houston model. Houston PD was, obviously a much, much larger agency, and I mean, they have divisions of what I'm trying to accomplish here. But I've seen the stories coming out of the larger cities of what this outreach is actually providing. If you recall the Angel story out of Gloucester about 7 years ago, and how they started promoting police-assisted recovery as it relates to addiction. This kind of models after that. So there is data out there that shows that when police officers are involved in the beginning, bring in that type of support system, there's greater outlook on recovery and long-lasting recovery. Our police department tracks data through a program that was provided by the district attorney's office. It's called Critical Incident Management System. And we have seen just what we've been doing the past year, because I've been utilizing on a part-time basis our CIT deployments to deal with substance use disorder. And we are seeing some data come in now that's showing less repetitive overdoses. When we track overdoses in the city, we track them through this management system, and I can see if someone has overdosed 7, 8, 9 times, they become a high risk on this management tracking system. And what we are seeing is the habitual overdose person, those numbers are coming down a little bit, where it's not 7, 8, 9 times. Now it's 5, 6, 4. Those numbers are coming down. But from what we researched in the last 3 years, this is probably one of the most promising models for law enforcement to take on, because, quite frankly, as I stated, we have the client list. Unfortunately, we're the ones responding, along with, the firefighters with their medic wagons. We're the ones that are responding. We have the client list, so it just makes perfect sense that we provide this additional resource. Specific data I can't give you right now, but I can tell you that everything we've researched was very promising in this type of model.
I'm sure, I have no doubt, and I look forward to seeing all the good that this grant will do. Thank you. I yield the floor.
Mr. President, they did it at Bourne.
Sorry?
Bourne had it, down at Cape.
Oh, yeah, yeah.
They did it a couple of years ago, Bourne did it. And that's how we started. I remember, instead of arresting the people, they were working with the...
We also have a jail diversion program where we try to push people away from the criminal justice system. Prior to the pandemic, we had a drug court coming to Fitchburg to deal specifically. That's still on track as soon as we can get beyond some of this pandemic issues. There's a lot of good stuff happening here. Bourne is one of the progressive police departments. Arlington PD, another PD that is very progressive. And I like to think the Fitchburg Police Department leads the way on progressiveness and reimagining policing today. So thank you for your time tonight, councilors.
Oh, no problem. And while we still are open, I have to say, it's no secret that I'm a very conservative person, but that's the kind of progressive thinking that I really love to see, is where it means, coming up with creative solutions for problems that have defied solution for so long, trying new things, not in a scattergun approach, but, based on sound logic and proven techniques. Everyone tries a little bit of something, and what works gets passed on. I love to see that kind of collaboration, and I hope that we continue to take in, I know that your department will continue to take in good ideas from everywhere you can find them, because that's what we've seen from you. So, that said, can I have a renewed motion?
I renew my motion to approve.
I'll let the junior chairs say second.
I'll second it.
All right, thank you. I have a motion and second to approve. If there is no objection, it is approved.
Thank you.
Thank you very much, Chief.
Thank you, Chief.
Thank you, Chief. Keep up the good work.
All right, last on the agenda, we have further discussion about adjusting the meeting days and times for this committee. I'll let Auditor Brooks give a summary of what he's pulled together. I do want to note that Councillor Di Natale obviously is not here, and I would defer largely, as president, I would defer largely to him as chair. But he has communicated his intentions on this subject. So, Auditor Brooks, if you'd like to give us an overview.
Yes, thank you, Mr. President. So, I think at the last meeting, we talked about, or the committee talked about shifting the meeting night to Mondays. And after the meeting, in looking at the calendar and so on, there were some issues with Mondays. Monday being very often a Monday holiday, which could foul up the schedule. The school committee meets on Mondays, and so if they have to delay a meeting, then they're running into the second or fourth Mondays, which is when this committee would normally meet. And if you look at this February and this March in particular, the second and fourth Mondays fall the night before the third, gotta get this right, the third Tuesday, no, the fourth Tuesday, I don't know, they come at the wrong time, before the Tuesday council meetings. They come the night before. So I went back to Wednesdays, just to look at the Wednesday schedule. If this committee were to switch to Wednesdays being the second and the fourth Wednesdays, on the second Wednesday, the Water Wastewater Commission is meeting, and the Conservation Commission is meeting. And I've talked with City Hall staff for both of those groups who have said that they would be willing to shift those meetings to a different night. The Airport Commission meets on the fourth Wednesday. I've had some early conversations with the chairman, Mr. Raymond, and that could take a little bit more work because they have historically met the fourth Wednesday of the month. I can continue to work on that if that's the desire of this group. I did send this information to Councilor Di Natale, and he did email me back saying that Wednesday was the meeting night that he would prefer at this point, if we can make this work.
Councilor Cruz?
Wednesday would be ideal for me as well. Wednesday's no problem.
It doesn't make a difference to me, I'm retired.
All right.
I can make Wednesday work as well.
So we've got 2 votes for Wednesday, 1 vote for Slacker. And no, I mean, I'm joking, but yeah, Wednesday would work for me as well. And as I said at the last meeting, I'm certainly inclined to attempt to accommodate the Airport Commission if there's a way that we can do so. But it's sounding like we've exhausted most of our other options. Monday would displace a larger number of, or would cause a larger number of issues, and Thursday is too late to get reports in time for the council. So I think, unless someone comes up with a better idea, I do think that the way to go would be to, as respectfully as possible, tell the Airport Commission that, they need to either find another date or another venue, which is unfortunate. I wish we had been able to find a solution that would accommodate everyone, but that's just not always possible. Do we want, I don't think we need a formal motion on this or anything, but do we want to take sort of well, we've already taken sort of a straw poll. Everyone seems to be in favor of Wednesday. Still at 6 o'clock, I assume. Anyone suggesting a different time? No, I'm good with 6 as well. I think that's ideal for committee meetings, really.
5 minutes to 12.
What's that?
5 minutes to 12.
That doesn't give you much time to talk. No,
I'm all set with it.
All right.
okay, so 6 o'clock.
So that I can work, if it's all right, I'll talk to those other groups and see if we can begin to shift them around. This isn't a change that's going to happen in the next couple of weeks. I think it's going to take each of the groups time to get their schedules reset, so then this committee could get reset after that, if that's all right.
I mean, as I said, on matters of that nature, I would certainly defer to Chairman Di Natale, and I assume that my fellow committee members probably would as well. But just a moment, Councillor. But yeah, that sounds reasonable to me, certainly, as long as it doesn't get dragged out. I don't mean on your part, Calvin. I just mean in general. Councillor Brochman?
I think we ought to set a time limit, maybe a month, maybe 2, and that's it. Because this could be dragged out forever. I mean, it should be a time limit. Because we're coming into the summer months and people are going to make different plans too. So
I would suggest that maybe we give it 2 weeks or so and see if there's a need to set an ultimatum. Because setting deadlines has an aggressive tone to it, and I'd rather get through this with as few people feeling like they're being pushed around as possible. But if we do get to the end of the month and there's no motion on it yet, then maybe we do need to set a deadline and say, on this, as of this meeting date, we will be meeting here on Wednesdays, and you've got to have it solved by then. But I hope we won't need to do that. I do agree it may be necessary, but I hope it won't be.
All right, I get no problem, just thought
Yeah, no, it's a good comment. I think so anyway. But anyone else have any thoughts on the matter?
Nope.
All right, in that case, if there's no objection, we'll continue to hold this for future developments and consider it to have been dealt with for tonight.
make a motion, we adjourn?
Second?
Motion and second to adjourn. If there is no objection, we are adjourned.